I am Moreno Toldo, the medical director of KIRAN Center. In KIRAN Center we care for all children coming to the school and girls and boys coming to the vocational training. Altogether they are around 350. Two-thirds of them are affected by some sort of disability, motor and or cognitive, especially cerebral palsy, polio, mental retardation, Down syndrome, spina bifida, muscle dystrophy. First of all, because most of them come from poor families with a poor economical and social background, we take care of their health condition and nutritional status. We provide them nutritious food through our canteen, and in case of need of supplementation with vitamins, we give them through our dispensary unit. In case they need also medicine, we provide medicine to them. And each year we do a health checkup. For those in need of physiotherapy, we have a physiotherapy unit where children can receive therapy by physiotherapist, occupational therapist, and they provide, apart from the physiotherapeutic classic techniques, hippotherapy, we have a small horse, a hydropool therapy and a trampoline. All these activities are done in the physiotherapy unit room we have or in the playground. In the orthotic workshop, very good quality orthotic devices are made using lightweight polypropylene, and for those in need we provide foot, ankle, knee, hip orthosis, brace orthosis and hand splint. But how children come to KIRAN Center and are admitted to the school? We have the parent and child care unit, a sort of outpatient unit, the entrance door of KIRAN, where a special educator and an occupational therapist every day meet parents of disabled children who come for consultation. And through this unit we give counseling, assessment, evaluation of the child, and then we provide them with therapy and education. I am also regularly visiting this unit and give diagnosis and therapy in case of need. When children have some problems in relation to psychological problems or speech problems, then we have a clinical psychologist and a speech therapist also. According to child situation and the family situation, we devise together with their parents a sort of plan of therapy and education. So we instruct, we help the parents understand what is the situation of the child, how to help him or her, and they do this therapy at home. So it is a sort of a family-centered approach, the approach that we are using. Then the parents come at the follow-ups so that we can follow them over the time. A child who needs intensive physiotherapy, for example for gait training, can come to our outreach hostel and stay there for 1-2 weeks. We have also a special unit which we call Mothers Training. In this unit we collect mothers of children with complex situations, for example in cerebral palsy, situation in which the parent often do not know how to properly deal with them in the daily activities, for example in toileting, feeding and transferring from bed to chair. So they need help from our part, so we invite them in groups of 4-6 mothers with their child, and they stay with us for 1 week. During this week we have meetings with the parents as a team of professionals. We are so physiotherapists, occupational therapists, special educator, the psychologist, the speech therapist, and myself. And we give them whatever is needed for them to understand how to manage with their child. This sort of mother's training is very successful. We see that the parents, not only mothers but also fathers, often come to see what we are doing, and they are very happy of the results that we get. Then we have the outreach unit, a unit made of physiotherapist, occupational therapist also, a orthotechnician, a special educator, and myself. The outreach unit organizes camps in the villages, and we every month go for a few days in a mission station where some services are provided to the children and youth with some disability directly in their villages. So what we give them is a technical support so that we can help them in diagnosis, both medical diagnosis and functional diagnosis, and we provide them with the same sort of advices and support that we give through mother's training. So the parents will be the teacher and the physiotherapist of their own children. In case of need, we call the children in Kiran Center so that we can provide them with orthotic devices. We can give intensive physiotherapy, and in case of need also we organize for surgeries, for example orthopedic surgeries, which can be done in some hospitals of the city where we have a good support, and they provide good surgeries at a very low price for the family. Our community-based rehabilitation is a unit working in 40 villages close to Kiran Center, where we provide not only therapy, physical therapy and education to the children and the youth, but also we help the families, providing them the possibility of entry in self-help groups. We provide them income generating programs so that they can make a living out of this little amount of loans that we give to them. We help them creating organizations of people with disability, and we organize also health education programs.